And the way he presents is like, I said, it's like Ernie Els's golf swing. I don't know if you know Jim Furyk. He's got probably the ugliest golf swing in the world, but that's the way it's with me. So I did lecture for a while, and for about 4 years at the Medical University of South Africa. And but it is different, you know. It's easier to talk to students than to an adult. So this is actually the first time I've ever done this. But so I hope I want to make it very casual. I'm going to tell you more the way I would do it in my practice, what I do with people with ADHD. ADHD is actually for the first time lectured in Canada, according to Dr.
There she is.
So adult ADHD, first lecture given to psychiatrists was in 2015. So it's a pretty new thing, and for adults, I mean, we know that for young people it's been, we know it for a long time, and usually the young kids present with the hyperactivity, jumping up and down, and that's how we diagnose it. But adult ADHD, especially because when we get into adulthood, the hyperactivity symptoms actually go away, and you see more the inattentive symptoms. So, when Pastor Brian asked me if I would talk about mental health, I immediately wanted to say to him, I'd like to talk about adult ADHD, because it's something I know pretty well. I've attended a lot of lectures presented by Tom Jansen, who is a real specialist in that field. Also, Alexander Martin, one of the top psychiatrists on adult ADHD, and then Timothy Bulkey, who comes from Barry, and he wrote a book, Fast Minds, which is a thing that you guys can read if you're interested in that, on adult ADHD. So why ADHD? Why is it important? A lot of people with anxiety disorders, depression, bipolar disorders, anger issues, might be treated for years and years with medication, psychotherapy, and never really get better. They say, well, the medication is helping me somewhat, but I don't feel really that good. There's something lacking. And now that we know a bit more about adult ADHD, we found that there's quite a large percentage of people with anxiety and depression and bipolar depression that can be helped. Just as an example, I mean, a while ago, you know, a lot of in schools might say, well, ADHD, it's nonsense, I have to be disciplined, all that. And I use the example, I had a boy that come into my office with his parents, and he would be on the examining bed, up, down, probably about 20 times while I was consulting the parents more so. And you give them medication, and it sits down and he's fine. So ADHD is basically a lack of dopamine and norepinephrine in the brain. Now, it's more complex because it's all about a connection between the prefrontal cortex and other parts of the brain, but that's what we focus on. So sometimes people with anxiety disorders will come and they've been treated with, you might know that, SSRIs, Cipralex or Zoloft, which is sertraline, paroxetine, which is Paxil. And what it does, it pushes up serotonin. Okay, but unfortunately, sometimes it pushes down dopamine and norepinephrine. So actually, if you give that to people with ADHD, you might worsen the whole case. So they might actually feel worse. You know, the anxiety is better, but brain fog and all that will be lacking. The reason why I've got slides that I'm going to use. I just wanted to do an introduction first and see if I can stimulate your little interest in that first before we do slides, because slides can sometimes be impersonal, but it's going to help me also to keep focus on what I need to do. So ADHD, there's three kinds of ADHD. We have the inattentive type, the mixed type, and the hyperactivity one. we think about 4.5 to 5% of the adult population have ADHD. It's the third most diagnosed mental health disorder, apart from anxiety and depression. Just an example, I had a patient that came to see me, very nice guy. He was a superintendent at one of the golf courses. He got the award as the best improved golf course in Ontario, but had difficulties with his mental health. I mean, he was diagnosed with anxiety, depression. He would wake up in the night, middle of the night, panic attacks, and he's been treated with mood stabilizers, antidepressants, and I would see him probably every 2-3 weeks in the office. Nice gentleman to see. I enjoyed seeing him. It's not that it was difficult to see him like people with borderline personality disorders. They are more difficult to see because there's not really no treatment for that. But in any case, and he just kept on not feeling good. And we decided to go through his history, and I started back. And we think people with ADHD should have these symptoms before 12, before we should diagnose it, but there's no new data, so maybe we should not focus on that alone. But in any case, I went through school and focus problems and so forth, which we'll see on the slides later on. I gave him medication for ADHD because we think, well, maybe that could be. He said that's the biggest change in his whole life. I see him now once in 6 months. He takes the medication in the evening to be able to sleep. So it slows his brain down. So this is just a few interesting things. Next first slide, and I'll just explain to you what's going on. So,
just tell me when you want to go to the next.
Yeah. Okay. Is this the first one?
Yeah.
So I've got to put my glasses on because I'm going to be able to read it as well. 1 in 4 children with ADHD. If you have a parent with ADHD, your chances of having it is 1 to 4 of the kids will have children with ADHD as parents with ADHD, the other way around. Twin studies, okay, 76% of twins will have, the other twin will have ADHD, the one has it. And the risk in first degree relatives is about 30 to 40%. Just another important thing is people with ADHD live 10 years shorter than expected. That's a very important thing because that's why it's so important to recognize it and treat it. 10 years shorter. Because, I mean, inattentiveness, motor vehicle accidents, and then they want to push at the dopamine and norepinephrine, so they use drugs because that helps them. You know, they use marijuana or they smoke and it pushes up their dopamine as to cocaine. So that's why we get substance use disorders with these people. Next one. Okay. So I'm not going to go into the pathophysiology too much. It's a lack of dopamine and norepinephrine, we think. That's why we give stimulants. If you don't have enough dopamine and norepinephrine, you'll have the symptoms that we'll go through with ADHD. If we give them medication, it improves. Genetics is very complex. I mean, I don't even know anything about that. I skip that part usually because that's very, it's more for research and not for practical clinical value. Okay, next one. So ADHD prevalence, 1.8 million Canadians have ADHD. And I think it's going to be more because, I mean, if a psychiatrist would be lectured on that as from 2015, there would a lot of been older psychiatrists that would not really have a lot of experience with that. I think they do postgraduate training with that. But in any case, so 3 to 5% of adults have ADHD, and like I say, many might be undiagnosed, and the prevalence of ADHD has been stable for past years. So this is an interesting thing. I think in my clinic, I think it's going to change. I'm more aware of that. So I will diagnose more. But they claim that it hasn't gone up, and people are saying, well, it's been abused. One thing in between, I get a lot of young kids coming to me at university. I say, well, you know, I can't focus, I can't concentrate, and so forth. And I mean, the internet's available. They can go and look up what's the symptoms of ADHD. And I think you all know that how Adderall and all these medications are abused at university. Only problem with that is they claim that if you use that to study, you cannot recall. So it's actually a negative thing. If they don't have ADHD and you give them medication, they might do worse in the exams than they would have done without using it. It's interesting thing to say. Next one. So that's just the diagnostic criteria. I use this. I'll pass it by. If you want to, you can just look at that. There's not too many of them. You can pass it by. There's 10 of them. I don't know how many people there's going to be, but I use that. It's actually the one that CADRA, which is the Canadian ADHD Society, is using. But in any case, this is a DSM-5 diagnostic criteria. The inattention, poor attention to detail, my careless mistake. In adults, they miss details, several inaccuracies. Difficulty sustaining attention, difficulty, and in adults it may present as a difficulty remaining focused during conversations, lengthy reading. Mind seems to be elsewhere when spoken to. They start something, do not complete it, procrastinate, wait until the last moment to do things. Anything that avoid paperwork and all those kind of things, they try and avoid that. It's interesting also that if you look at people with ADHD, what kind of jobs they're looking for. Emergency physicians. I'm not saying all of them have it, but that's what they do because there's action, there's something going on. So that's what they lose things, loses wallets. Where's that? You know, asking who did that? Where's that? Distracted by unrelated thoughts. But I think we all, you hope everybody forgets these things sometimes. So distracted by unrelated thoughts. And I had a psychologist who's a patient of mine telling me she plays a little video to people to understand ADHD. She says, so a normal person will sit in a room like this and listening to the speaker and can concentrate on the speaker. But the ones with ADHD hear the noises, the bottles that fall, someone saying something there, something moving there, and that's easily distracted. Forgets to run errands, return calls, or pay bills, and so forth. Okay. The hyperactivity, that's the one that we don't usually miss. That's the one that fidgets and you see difficult still sitting at the desk or having breakfast and you see a child sit there and they can't. They have to get up or they have to run around and come back and don't finish the meal as well. In adults, this is usually limited to feeling restless. And that's the whole thing. In adulthood, it's more the inattentiveness that we notice, not the hyperactivity. Cannot wait to turn in conversation, interrupt people, difficulty waiting in a line, anger. Probably one of my patients was involved in a lot of arguments on the road. What's it called? Road rage. I had the one gentleman, he exposed himself turned his behind and showed the guy what's going on, what he thought of himself on the road, and actually he's now good with the medication. But in any case, another one with ADHD. The next one I can do. So this is just important that, this is just a diagnostic thing. You have to have these symptoms, got to be 5 of the symptoms must be present. It has to be there more than 6 months. It's got to be in more than one setting, so at home, at work, or school, and so forth. And then the important thing is, a lot of people say, well, I don't focus as well, I don't do that as well, and I can't concentrate, but they do still well in society, and then they're feeling well. Then I would avoid medication at that time. But in any case, and then there they say symptoms must be present before the age of 12. But that's now that's now debated on. Let's say a lot of people, adults, we make diagnosis because we know more about it. That we basically adult onset. Okay, so it's not missed symptoms; it's adult onset ADHD. Right, I think the next one. So here it is. It can be hyperactivity, impulsive symptoms, executive function problems, inattentive, combined symptoms. Okay, and obviously, like I said, it can differ in children and adults. So here's the important thing. I mean, ADHD, medication is very effective. But you don't want to do only medication. You want to try and they do CBT. There's some, we're not too sure if it really, they do neurofeedback and all that, if it really works. They claim it does. Maybe we know a bit more about it now, and we can maybe focus on a different way of CBT treatment. But whenever I see a patient in the office, that's what I do. I go through these kind of things and talk to them, because young kids with ADHD, you want to give them structure. You know, get up at the same time, eat at the same time, brush your teeth after that, because otherwise the things just, there's too many things in their mind and so forth. You know, I had a patient, a young guy with ADHD, and was given medication, and he didn't want to take it. So I asked him why, and he said, I felt boring. So he didn't want to feel, he didn't want to focus, you know, he'd like to think of all these things. So, but anyways, that's this is the multimodal treatment approach. How much time do I have? Is it, sorry,
10:02 right
10:25.
Okay, so I want to,
20 minutes.
okay, so I'll go through this. This quickly. I want to get to the pharmacological part as well, because that's important, and that kind of take a bit of time. So what we do is the psychoeducation. We tell people about ADHD. I like to do it in my office. Tell them there's a lack of dopamine and norepinephrine, and I tell them why we're doing this and why do you resort to drugs, or why do you. I mean, people that exercise do better if they've got ADHD, because they secrete encephalines and endorphins, and it makes them calm. So all those kind of things, balanced lifestyle, eating healthy, and all those kind of, is important. All right, thank you. I needed my son to help me with these slides, and I didn't have time. I said to Pastor Brian, I got home late last night, and so sometimes it might be some ones in between that I'll come back to things I've already said. I think this one we've talked about. We can go to the next one. There's a mindfulness at the bottom that you talked about. So here's the executive function: judgment, analysis, problem solving, critical thinking, forward thinking. Remember, a lot of these things you can get with anxiety disorders. You get a lot of them with depression. The same symptoms, they overlap. And that's why if a patient comes into my office and they've got a failed treatment on anxiety, or it failed with depression, you've got to think about this, because you can sometimes help people. And I think this is why I like to talk about this, because you can really change people's lives, and not only their lives, but the family life, at school, at home, and all that. Correct social personality expression, all that complex cognitive behaviors, working memory. But that's basically, I think everybody knows that. And just this way, the prefrontal cortex play a role. Attention and behavioral is more a little bit behind that. Okay, next one. This is interesting. So, of inheritability, height is a thing that is inherited the most. Next is ADHD. The next one is schizophrenia. The next one would be, I think it is panic disorders, general anxiety disorders. Colon cancer is not as inherited as ADHD and height. This is just very interesting to me as well. Breast cancer also now. Okay. If a parent has ADHD, the risk of the offspring is 57%. If a child has ADHD, the risk to at least one parent is 55%. So it's highly inherited. Thank you. Next one. Worldwide, I'll go through that as well. I'd like to keep some time for questions as well, but I know the panel, we're going to do it later as well, but there might be some questions that people have that I maybe can answer. But in any case, 80% of ADHD has never been diagnosed and treated. And that's the problem, because we only started being aware of that actually in 2015. Okay. Gender specific. So this is why we miss a lot of females. because they present at school more with the inattentive symptoms, and the boys with the hyperactivity symptoms. And that's why, you know, a lot of high percentage of patients that I see with ADHD that's missed as females. All right. And they present with anxiety, depression, and bipolar disorders, or diagnosed with bipolar disorders. Dr. Martin Alexander, or Alexander Martin, he said before he became aware of ADHD, he diagnosed a lot of patients with bipolar depression, because the manic phase can be a little bit like hyperactivity as well. And he said since they're more aware, he's treated a lot of people that he can take off completely off their mood stabilizers and just on ADHD medication. Classroom disruption, I mean, the teachers would know that. Risky driving, that's why we have a higher mortality rate. Promiscuous behavior, pregnancies. Okay, so yeah, no, that's good, I think. Inattention drives percentage of ADHD. So when we get older, inattention more prevalent, younger hyperactivity symptoms more. So the hyperactivity symptoms are more less prevalent. Okay, the next one. So this is the one thing that I started saying. It never travels, or seldomly travels alone. Usually you have anxiety disorders with it, eating disorders, overweight, sleep disturbances, substance abuse, bipolar disorders, depression, dysthymia. So it's just important, and that's why I like to talk about ADHD, because these are the people that you're not going to help them if you don't treat the ADHD. I mean, you give them medication for ADHD, almost immediate response. They will know the same day. I prescribed to a young guy, he was about 30 years old. He had a depression, anxiety for all his life. Was actually on SSRIs that actually push up the serotonin and push down the dopamine and the norepinephrine. And he, this thing's falling. And so I started him, we went through his history, and I started him on medication. I gave it the previous day. 11 o'clock the next day, he called my office, called the receptionist. He says, this is it. So they know immediately. Very robust response that you get to medication. All right, next one. This is what happens if with ADHD. You know, it's the drugs, legal issues, driving without license, injuries, risky sexual behaviors, comorbidities, mood disorders that we talked about, academic problems, and that's why at school, if the kids are, well, I'm not talking about children and ADHD today, but it's something too important to manage, because they don't have friends later on. They don't have no social interaction, not liked. Teachers pick on them because they're the ones that's naughty in the class. Okay, academic failure, not doing as well as they should. Traffic violations. Okay, substance abuse, like I said, no. Marital problems, and that's the thing. It's not only an illness that affects him; it affects the people around him as well. Children of adults with ADHD and parents of children with ADHD have a tough time. All right, next one. There's risky behaviors and all that. I think we've done that. We can go on to the next one.
Okay. We'll just let people look at it for a second.
Okay.
Just if you want to see the statistics
No, that's
of it.
Yeah, oh yeah, that's actually fired from the job. If you control it to the control, how many is fired from the job, how much do not enter college, unemployment. And actually, these are sometimes very clever kids. I mean, there was a story that Einstein had ADHD. Well, that time I don't know if I knew about that, but all right. Okay, interviews. This is what we do. We look at all these kind of things. So when someone comes in, I mean, this is for everybody. I would look at performance, attention, and all those things before I make a diagnosis. Okay, next one. I think we talked about this a little bit. I can come back if we want to, but I just want to get to the medication now. Okay, that. I think we've talked about this as well. Yeah, we can go on. So this is the one that I've just sent around. That's what I use. If you have 4 or more of the top one, the dark areas, your chances of ADHD is it's very likely. Unfortunately, this diagnosis, about 26% of people that fill it in will have ADHD. So we think we overdiagnose a little bit with that. So that's why it's so important to look at all the other things, school performance, relationships at home, and how it affects his life. All right, next one. Okay, I think we've talked about that. Good sleep, hygiene, regular exercise. These are very important, and especially structure. These young people and older people, I mean, they need structure. If they don't have to, oh yeah, I forgot to brush my teeth, or I forgot to do this. You know, they have reminders, and this is what they do to give them structure. It's very important. Anger management. I mean, I had a psychologist said such a nice thing about anger. He said, anger is just a complete waste of time. He says, you have to, in any case, find a solution. So before you get angry, just say, can I fix it or can't I fix it? And you talked about it a little bit as well. So if you can fix it, do it. And if you can't fix it, let it go. You know, that kind of thing. Okay, so now the treatment. So this is one that I'd like to talk about. So we use, for ADHD, the best medication is the stimulants. And this is interesting. So if I would give people that don't have any ADHD, if I give them medication for a stimulant, they'll be anxious, the heart will racing, they'll be agitated, irritable. You give it to the people with ADHD, they calm down. They feel peaceful. You know, so that's the symptoms of ADHD diminish. So we use the stimulants. There's two groups that we use. We use amphetamines and we use methylphenidate. It doesn't matter which one you start with. Most of these specialists say they start with the amphetamines, which is Vyvanse mostly that they start with. It's a bit of a prodrug, so it gets becomes active in the body itself, so it's a less abuse potential. Adderall I don't use because it's a amphetamine. They can open their little capsules and they can take out the big particles, and it gives them a sudden boost. So they can abuse that. So that's why we try not to use that one. Your methylphenidate is your Concerta, your Bifenton, and Foquest, which is a long-acting one. So all these work about for 12 hours, except Foquest, it works for about 16 hours. So if you have young people in class, they might be able not to study in the evening. So they use the medication, they're good until 4 o'clock, and when they get home, they're a bit disruptive as well. Sometimes that's good to use a longer-acting one like Foquest. The older ones like Ritalin that you guys probably know all about, and Dexedrine, I don't like to use it. It's too short-acting. You've got to use multiple doses. Your concentration will go up in the bloodstream, it will fall, and they up and then down, and so you'd like to give the long-acting ones. If you give amphetamine, a third of patients that do have ADHD will respond to amphetamine alone. If you give the methylphenidate, a third of them will respond to that alone, and another third will respond to either one of them. So in other words, if I prescribe, say, Vyvanse to a patient and it doesn't work, it doesn't mean that they don't have ADHD. You have to go to the other one and try that as well. When people come into my office and they have anxiety disorder and ADHD, now it's difficult. Now you've got to first treat the anxiety disorder. But if you give them an amphetamine, you can make his anxiety worse. You can help his ADHD, but his anxieties go. I had a patient that I gave it, and she was in the evening. She ended up in the ER. So the important thing is that control first the anxiety, to a lesser degree the depression, but anxiety before you do before you control the ADHD. And then obviously we don't like to use the SSRIs, which is the serotonin reuptake inhibitors, like people know the Zoloft and the Cipralex and so forth. We increase the medication, the dose every week or 2 weeks, and I usually have a consultation with them every week and see how it goes until they stabilized. When they stabilized, I'll follow up every 6 months or 3 months. It depends on how they're doing. We cannot prescribe for longer than 3 months. Usually, you can do it by giving repeats, but you cannot do a repeat. You've got to say 270, dispense 90 every 30 days or something like that. So then we get also the non-stimulant group for ADHD. I use that a lot in people with anxiety disorders and I want to treat their ADHD. It's not as effective as your stimulants, but it's helpful. And there's two of them. It's Strattera and it's a tamoxifen. Can you go to the next one? I think I have it in. Oh yeah, there you are. That's the stimulants. We've talked about that. Next one. So you get your atomoxetine, which is Strattera, and you have your Internuve, which is the one I've seen. They take about 2 weeks before they start working. The other ones work immediately. You know, if I give you a Vyvanse today, you're going to know the same day if the dose is correct. You'll see and say, well, I feel so much better. My anxiety is gone. I can focus. I feel relaxed. You know, but these take about 1 to 2 weeks to work. So typically for people with anxiety, where we cannot struggle to control the anxiety and they have ADHD, then I'll use this. The other one that we use is Wellbutrin. It's a bupropion. You might have heard of that. It also increases dopamine. It's a second line. It's not as effective as the others, but it is sometimes useful to treat people with depression. So I start with Wellbutrin rather than I would start with the SSRIs. Okay, here you are. Okay, there's a third that I've already talked about that. Response rate of 90 to 95%. That's fantastic. And so, okay, the next one. The dosing, I don't know. You don't have to talk about that. You can go to the next one. Thank you. Maximum doses. I don't know if you want to look at that. Maybe some of you guys are on that. So Concerta, the bottom 72 milligrams for kids, we can go up to 108 milligrams. It's 18 milligrams or 36 milligrams tablets. That's why you get these funny doses. Foquest, you can go to 100 milligrams in adults. That's a long-acting one. I like it a little bit. And Vyvanse, 70 milligrams. We use Vyvanse, interesting enough, also for binge eating disorders. Okay, so people that binge eat, and that's a big problem you see with ADHD in any case. That's probably why it works. And you start slow because otherwise they have side effects of the medication. Okay, next one. Okay, side effects. This decreased appetite is a problem, especially in kids. And we have to weigh them, and it's difficult if they don't put on weight and you have them on the medication. And so I tell them before you eat before you take the medication in the morning, eat your breakfast, and then later in the evening it should be, and maybe in the day take smoothies or something like that taste good. Insomnia, that's the interesting thing. Actually, it can help insomnia as well because it slows your brain down. But that can be a problem as well. Irritability, obviously, it's amphetamine. It's a stimulant, headaches, which could be heart rate and blood pressure, basically because it's a stimulant. So if you have hypertension, just know that if you take the medication, your blood pressure will probably go up slightly. The next one. Okay, so that's I went quickly because I know there might be questions because it's a pretty new thing, and I don't know if too many people have heard about, well, know about it, but I heard a lot about it. So. Yes.
You talk about ADHD. Do you also treat ADD, or is that not anymore?
That's correct. Yeah, we used to say ADD is the inattentive, but now we classify it as ADHD, inattentive, which is the old ADD, and the mixed type and the hyperactivity type. So this is a different classification that we used before the ADD. Yes.
Do you recognize any relationship between Tourette's and ADHD? Children manifesting tics.
Well, I think if you overtreat them.
Okay.
I answer you just what I think because I don't really, but it just makes sense if you definitely if you give people that use cocaine and all those kind of things when they push up, and they sit with the tics as well. So I don't think you're gonna. That's difficult. I don't know if you're going to increase it with someone with Tourette's. If you just up the dopamine and norepinephrine to normal levels, it's not supposed to be. So that would be my answer.
Okay.
Are there similarities central auditory processing. Because I'm seeing some.
Yeah. And that's usually in children that we'll first see it. I mean, that's it, yeah. Well, I think what you've got to do is you've got to go through your history and see if there's any other symptoms or signs that it could be ADHD and maybe not the CAP, which it can be an entity by itself. So obviously, if I have someone with CAP, I'll definitely I'll look at the other differential diagnosis and see if it's ADHD, if you can treat that and see. Interesting for autism, they use the stimulants as well.
You talked about medications. Now, is there also other type of help as far as like a counseling type of help for people as well?
Yeah. So that was very controversial a while ago. There's a place in Mississauga, actually, that's worked with ADHD. They do sessions, they do neurofeedback and all that. Now, the newer, I've got actually a whole, I looked at, we use up-to-date, there's a newer things on medicine, and they talk about CBT that can be helpful. It's actually more to help people to cope with that. You know, so how do you cope with that? And that's I try to convince people to be structured as well. I mean, but I'll send them to, we have a few counselors in our office that we can use for that, and it's very helpful. So we use that. There should be a holistic approach for that. I mean, like I've said to you in the beginning, the psychoeducation, but it's also the family, you know. So if you have a husband with ADHD, it can have it can tough on a wife. Even if it's just inattentive, you know. So. You're back. You want to ask me something? Yes.
I have a question. So I know you said you could set up routines and stuff, and I know drugs, I know the pills aren't the answer. It's just to help. But people that have like severe ADHD or like even like can they wean off of it? Or are they always on it?
No, they can wean off it.
Okay.
I mean, sometimes what I've seen with my patients is they feel terrible and they don't feel good and they've got brain fog and they can't concentrate and they forget things. And you treat them with a medication and they say, "Oh my goodness, I feel much better. I can do that." And then sometimes they say, "Well, actually, I can cope now. I know what it is." So some of them do that. Exercise. Medication is very important in this. I would. Especially the fact that, you know, ADHD patients live 10 years shorter. That's a statistic that that both Tom Jansen, he's in London, and Dr. Martin, who's in Mississauga area, gave us in a lecture that I attended. Anyone else? How much time we have? Is it gone?
2 minutes.
That's right.
I have a question.
Yes.
Is it possible for you to share your slideshow if they give you their email addresses to your son? Is
That could be a problem.
If you guys would like to have that,
I'll
for
have
your
to.
own, information. I don't know if that's possible.
I actually contacted the slideshow that I got from one of the pharmaceutical representatives, so you would have seen FoQuest on that. He was not even allowed to give it to me. I don't know what's the legal things for that. So I said to him, I need it because I need to have structure in my talk.
But we'll just wait because we hope to publish this.
Yeah.
He will write a chapter to.
But I can always do that. I can take it off and then just put it there. I mean, this is for. I just want to see what the legal things for that is. It makes sense that I think everybody should be able to have a look at it because it's.
Everything from this slide onward, though, is a different
It's
thing.
marketing, yeah.
Yeah, so this is FoQuest, as you see on the right bottom,
Yeah.
but after that, this is just copy
I
and
think the
paste.
first
so I
one
think
will
we
be,
can
yeah. So I'll try and do that. But these things that's got nothing on that. I mean, these are available. If you go on CADRA, the website CADDRA, they have actually a lot of information for patients as well.
I have a question.
Yes.
What would you say is the basic primer? You mentioned a couple authors, but what would you say a good introductory book for it? And do you know any biblical resources, somebody starting from a biblical perspective on it?
No, I don't know any biblical. I can't come with that. A book that is written by Timothy Bulke is the one that I advise, Fast Minds. I think he published it with the help of, I think, Stanford University, so a pretty good book. There's one, Live with ADHD. I think there's books like that as well. But the Fast Minds one is 600 pages, but it's helpful. You know, you see the people with ADHD, you talk to them, the cars. I mean, you open the car and it's a mess inside. You know, all books lying around and so forth, and they actually explain it very well. You're welcome. Is that it?
Sir, maybe, our time's done, but maybe in conclusion, I can, I've got a relative that struggled in high school, like 50s and 60s averages. Once he was diagnosed and placed on a proper medication, he's now in his third year university of the 90s. So the difference, and I know this kid very well, the difference with him being on meds and not being on meds, I say to him when we go fishing, you take your meds today?
Yeah,
And many times he says, I didn't yet because I have to study tonight.
Yeah. So
it works.
I can tell you what precisely you've said. The gentleman, the one that I talked about, the bipolar depression, that was take it in the evening to sleep. He said it's the biggest change in his life that anything has ever made. So if you correctly diagnose it, you help people a lot. And this is basically what I was hoping for, that I can just make people think a little bit and say, well, I've got anxiety and I've got depression, but it never really get better with a medication, and we've got to think about the ADHD as well.
Do you treat patients like 65 years and older?
Yeah.
And there's no risk to like the older they are?
Well, you've got to make sure that they don't have cardiovascular illness, because it's a stimulant, they push up blood pressure and so forth. But no, I don't. I'll treat them except if there's a total contraindication, because if they feel so much better, you change their whole life. It's the most robust response to any central nervous system drug that we give, except if you give a benzodiazepine like lorazepam for anxiety. But these things, people take it and they would know. They will tell you, that's it. That's it. So I always ask them, said, I've given you the medication. How do you feel? And they say, oh, I feel so much more calm and so forth. Then you know you're on the right track. Hello.
Very nice.
I hope this is helpful. I don't hope I didn't speak too fast, because that's a problem I have. Oh, yeah.
Do you have particular drugs that you use just for anxiety?
Just for anxiety, not, and it's not nothing with ADHD to know that. If a patient have a anxiety disorder and they say, well, I manage quite well, but I need, 2 days a week I don't feel good. This is interesting. Sorry, I'm going to interrupt myself here. The difference between ADHD, their anxiety, is that it's always there. The people with anxiety disorders, it will be only the time when they have the anxiety episodes. So that's a difference. So if you have ADHD, you'll always have it. If you have an anxiety disorder, it might come and go. In any case, then I'll give them a lorazepam to put underneath the tongue when they need it, to help with panic attacks as well. It's addictive, but if they use it twice a week, it calms them down and so forth. If it's a general anxiety disorder where they need to take medication every day, I usually start with an SSRI. It's the guidelines like the Cipralex or Zoloft. If I need medication, obviously we do all the CBT and all those things as well. I'm talking about medication now. Zoloft I like a lot, but it's more difficult to get there because you've got to gradually increase the dose. Cipralex is quicker to get there. Your other ones that we use is Effexor, that's first line guidelines. There's a new one on the market, Trintellix, that actually push up dopamine, push up serotonin, and push up norepinephrine. So that's actually, we thought that this is the most wonderful drug that we have, but it's not about the absolute values. It's the relative concentrations of serotonin and norepinephrine and dopamine in the brain. So we don't know, we play around with that. But that's usually what I do. There's other things as well, but second one.
Dr. Venter, if you have more questions, you can write them down. I think we gave you a blank sheet of paper, and then there is a box. So for the panel discussion, we'll give our best to respond to your questions. I think it's time.
Coffee's ready.
Yeah, coffee's ready.
Church overflow.
Well, thank you.
Thank you
Don't
very
forget.